complications of a facelift procedures. One of the main complications is bleeding. It happens in less than 1% of the patients. Even though during the operation we are stopping anything that's bleeding, because the operation is done under direct visualization with an electrocautery device, if the patient bleeds after the operation, it could require us to take the patient back to the operating room to find out what's bleeding. Some of the things that we're looking for is that the patient have very controlled blood pressure, because one of the instances which cause increased bleeding following a facelift procedure would be poorly controlled blood pressure. I typically like my patients to stay in my office recovery suite overnight so that I can monitor their blood pressure and give them adequate pain control. One of the other complications can be infection, which is very rare. The patient is given antibiotics and gone home with antibiotics for a week. In certain patients, you can have some loss of the skin surrounding the areas of the incision. Once again, this is also very rare and typically more common in patients who are diabetics. And that's why we're very stringent to make sure that all patients undergo a medical clearance so that they are optimized prior to surgery, so that we are minimizing all the complications that can occur.